So, we've all heard about cancer feeding on sugar. So, the last part of my remarks today, I want to talk about how breast health begins with blood sugar balance. And this is going to be a separate, this is another talk, but it's starting with what we just talked about with insulin resistance. You don't want to have this insulin resistance going on when you have had a diagnosis of cancer, or if you're trying to avoid cancer, you don't want to have insulin resistance. Insulin resistance sets up or is probably the result of chronic inflammation, and it's at the cellular level. And if you have that chronic inflammation for a long time, you will see that your mitochondria won't work as well. So the mitochondria are the energy generators on the inside of the cell. And yeah, they are not going to work that well if you have had chronically elevated blood sugars. And cancer is a case where the mitochondria are sick inside of the cell and the mitochondria are not working as well as they should be. And then when that happens, you've probably heard of apoptosis, a situation where the cell death is occurring. Typically in a healthy person, you're going to have cells dying off that may be cancerous or precancerous. And of course, we're walking around with cancer cells floating around in our bloodstream all day long, every day. But if we have health and wellness, then our body is able to get that under control and to get rid of those cells. But when we have a lot of sick cells, the body's trying to make choices about what cells it's going to keep alive, which ones it's going to recycle, and the system kind of can get overwhelmed when you have chronic inflammation, chronically high blood sugar, when you have these things going on. So, sugar is in everything we eat, even the healthy things. But the idea is, like I mentioned before, that in insulin resistance, there may be an imbalance in the microbiome, and we need to first get that in order. We need to be consuming the fibers that the good bacteria need. There are things like Artemisia that we can take, the probiotics we can take to help improve that balance. There are other probiotics and fibers that we can consume, prebiotics, that also help to get that balance restored. So if there's someone that you know that's dealing with cancer, you may want to have them watch this video, because if you've been into a cancer center, and I have as a patient been into one, they often have candy jars and they're encouraging their patients to eat the candy. This is not a good idea, okay? And you can look it up yourself online. You can ask ChatGPT about sugar and cancer. This is not a combination that we want to have, because it's going to help the cancer to perpetuate. So it's not just about candy. It's not just about cookies, donuts, soda. It's about hidden sugars in healthy foods. Like if you look at the labels on yogurt, you can see that those sugar carbohydrate counts are pretty high on a lot of those yogurts that have flavors. And juice is just the fruit without the fiber, and it goes into the bloodstream really quickly. Like for example, orange juice, if you drink a quarter cup, it's going to take your blood sugar up past the normal range. So even granola bars have a lot of sugar, and we know that stress, sleeplessness, and gut health all affect your blood sugar. So what are things that we can do mindfully if we have breast cancer, or if we're concerned about our breast health? What can we do about nutrition? So eat whole, low glycemic foods, leafy greens. I try to eat a cup every day. cruciferous vegetables, because cruciferous vegetables have isoflurane, they have derivatives from the sulfur groups. Foods like broccoli, cauliflower, romanesco, kale, Brussels sprouts are high in these isofluranes that actually help to fight cancer cells. And it also supports estrogen detoxification, which is important in breast cancer. And omega-3s from fish, flax seeds, get rid of the inflammatory seed oils, and get rid of the empty sugar in the drinks. Balance your meals with high protein, fat, and fiber. And try intermittent fasting. And if your body allows it, it can help to reduce insulin and inflammation. If you're a menopausal woman, though, you need to be careful and probably get some professional advice about intermittent fasting, or do some extensive reading, or look at some of the people on YouTube talking about intermittent fasting. Some of us are experts on it. So many of us turn to sugar for comfort when we have emotional or stressful eating, especially during treatment or grief. And this is really common, especially for women. So give yourself grace, but also give your body what it truly needs: minerals, self-compassion. Try journaling, walking, meditating, instead of snacking when emotional hunger strikes. So movement and blood sugar. Of course, we want to do some movement, and I don't want to call it exercise because I know some people are allergic to that word, but we do want to be moving, and just a 10-minute walk after meals can help to lower your blood sugar. They also recently have done a study where if you're sitting and working all day, that they said that every 45 minutes, if you stand up and do 10 squats, that apparently mimics like walking around all day, and it helps to keep the blood sugar down and keep down the complications of high blood sugar. And there's no need for intense workouts, but think about walking, rebounding, gentle yoga. This gives some vibration to the body, so it helps the lymphatics to move. And it also helps with healing because it helps with the circulation after surgery or radiation, and it reduces the blood sugar spikes naturally. So what about toxins and hormonal chaos? Hormonal chaos is like this up and down that we get of the hormones, especially in menopause, that we don't want to have. So think about switching to non-toxic body care. In the United States, unfortunately, we don't have as much regulation as they do in Europe. So one thing you can do is go to a store like Whole Foods or Sprouts, get to know the brands, get to know which ones have the least number of toxins, and then you can purchase from wherever you find them. But at least in there, you can see some of the brands. And I've seen where online there's a plethora of these if you type in the right search items looking for them. So you don't want parabens, phthalates, because they mimic estrogen and they make the insulin resistance worse. So your body is not broken, it's adapting to these inputs. So if we can clean up what we're putting in the body, consuming, then that will help to clean up our bodies. So to wrap up, I want to say that blood sugar balance is very important in breast cancer prevention and also when you're getting treatment. And they've done studies, and some intermittent fasting can be incorporated in getting chemotherapy treatment, and it will sometimes potentiate the chemotherapy. And what that means is the chemotherapy will work more effectively in some people that are able to do it, and you need to consult with your doctors, your cancer doctors, your primary care, about whether this is the right choice for you. but it can cause the chemotherapy to work better. It gets into the cells better after a short fast. You can find me on Instagram. You can find me here on YouTube on our channel. You can find me on Facebook. And we'll link something free for you down below. So go ahead and grab that link, and then put a comment after you've looked at it and after you've looked at the whole video, and tell us what would you like to hear more about. All right. Thank you. Thanks for joining us today. Don't forget to hit that like button, hit the thumbs up, hit the subscribe button, and stay tuned for the next video. Looking forward to seeing you.